Let's learn about pica, simple and easy. It comes from the Latin word pica pica, which means magpie bird, which is known for its unusual eating habits. It is the most common behavioral problem in children less than 5 years of age. So, what's pica? It's the persistent, compulsive consumption of non nutritive, non edible substances over a period of at least 1 month. The common substances which are ingested by children are chalk, clay, sand, and earth. So, which is geophagy. Geo is earth. And ice. So, ice is phagophagy. Phago means ice. Ingestion of paint chips can also be a source of lead poisoning. And stones and hair. And ingestion of hair is trichophagy. So, this action is inappropriate to the developmental level of the child and it is culturally unacceptable. It is more common in children with intellectual disability. What causes pica? Mental retardation, psychosocial stress, which includes maternal deprivation, parental neglect and abuse, malnutrition, and iron deficiency anemia. The symptoms associated with pica are irritability, fatigue, weakness, breathlessness, and tachycardia, which is seen in iron deficiency anemia. And on examination, you'll be able to see pallor, angular stomatitis, glossitis, chorionica, which is spoon-shaped nails, and platynachia, which is flat-shaped nails. And the investigations are CBC, peripheral smear, iron profile, which includes TIBC, serum iron, serum ferritin, reticulocyte count, chest X-ray, and echo. The clinical associations with pica are lead poisoning, parasitic infections, iron deficiency anemia, mental retardation, vitamin and micronutrient deficiencies, and pseudotumor cerebri, which is false tumor of the brain, and it's also called as IIH, which is idiopathic intracranial hypertension, in which there is increased intracranial pressure. It is also associated with trichotillomania, which is the compulsive pulling of one's own hair, and trichobezoar, which is the presence of hairball in the stomach due to the ingestion of hair. Now let's see about the management of pica. So it is a treatment of underlying causes, alleviating psychosocial stress, and deworming for parasitic infections. For deworming, albendazole is given once in 6 months or twice a year. And 1 tablet or 400 mg is given for children 2 years or older. And half tablet or 200 mg is given for children 1 to 2 years. And treatment of iron deficiency anemia with iron and folic acid supplementation. And reducing cow's milk intake. And chelation therapy is done for lead poisoning, which includes dimercaprol or BAL for 4 mg per kg dose for every 4 hours IM, plus calcium meta 12.5 mg per kg per dose every 4 hours IM or IV. And these two medicines are discontinued after 2 days. And oral penicillamine is given at 25 mg per kg per day dose, and it's given for 5 days.